Tracheostomy. Tracheostomy is making an opening in the anterior wall of the trachea and converting it into a stoma on the skin surface. Functions of tracheostomy: to provide alternative pathway for breathing, improves alveolar ventilation, protects the airways, permits removal of tracheobronchial secretions, and to administer anesthesia. Types of tracheostomy: emergency tracheostomy, elective or tranquil tracheostomy, permanent tracheostomy, percutaneous dilatational tracheostomy, mini tracheostomy. Indications of tracheostomy: when there is respiratory obstruction, retained secretions, and respiratory insufficiency. Respiratory obstruction can be due to infections, trauma, neoplasms, foreign body larynx, edema larynx, bilateral abductor paralysis, congenital anomalies. Retained secretions due to inability to cough, painful cough, or aspiration of pharyngeal secretions. Respiratory insufficiency cause of chronic lung conditions. Technique: whenever possible, endotracheal intubation should be done before tracheostomy, especially important in infants and children. Position: patient lies supine with a pillow under the shoulders so that the neck is extended. This brings the trachea forward. Anesthesia: no anesthesia is required in unconscious patients or when it is an emergency procedure. In conscious patients, 1 to 2% lignocaine with epinephrine is given. Steps of operation: a vertical incision is made in the midline of the neck, extending from cricoid cartilage to just above the sternal notch. A transverse incision, 5 cm long and 2 fingers breadth, is made above the sternal notch and can be used in elective procedures. After incision, tissues are dissected in the midline. Dilated veins are either displaced or ligated. Strap muscles are separated in the midline and retracted laterally. Thyroid isthmus is displaced upwards or divided between the clamps and suture ligated. A few drops of 4% lignocaine are injected into the trachea to suppress cough when trachea is incised. Trachea is fixed with a hook and opened with a vertical incision in the region of the third and fourth or third and second rings. This is then converted into a circular opening. Tracheostomy tube of appropriate size is inserted and secured by tapes. Skin incision should not be sutured or packed tightly as it may lead to development of subcutaneous emphysema. Gauze dressing is placed between the skin and flange of the tube around the stoma. Complications: immediate, intermediate, and late. Immediate: at the time of operation, there can be hemorrhage, apnea, pneumothorax, injury to recurrent laryngeal nerves, aspiration of blood, injury to esophagus. Immediate: during first few hours or days, bleeding, displacement of the tube, blocking of the tube, subcutaneous emphysema, tracheitis and tracheobronchitis with crusting in trachea, local wound infection and granulations. Late: with prolonged use of the tube over a month or a week, hemorrhage, laryngeal stenosis, tracheal stenosis, tracheoesophageal fistula, problems of decannulation, persistent tracheocutaneous fistula, problems of tracheostomy scar, corrosion of tracheostomy tube and aspiration of its fragments into the tracheobronchial tree.